Hello, let me tell you about the radiofrequency ablation of a recurrence. The radiofrequency ablation is divided into 5 steps. First, we need to identify the location of the lesion to be treated, and the surrounding important structures on ultrasound. Then, local anesthesia is performed. The radiofrequency ablation is a procedure that burns the lesion at high temperatures. So if there are any important structures around the target lesion, you should keep them away from the lesion you want to burn. The method of separating the lesion from the surrounding structure with cold water is called hydrodissection. After that, place the radiofrequency ablation tip on the lesion and burn the lesion. I'll show you a case. He had undergone total thyroidectomy 15 years ago for thyroid papillary cancer at an outside hospital. Since then, he has had several recurrences of the neck and distant metastasis, and has been treated with radioiodine treatment and targeted chemotherapy. He did not do chemotherapy anymore because of the side effects of chemotherapy. Nevertheless, he is a person who lives without any problems in his daily life except a recurrence at his anterior neck. When he lay down, the lump in his neck pressed, and he had to turn his head sideways when he slept. This is a recurrence that makes him uncomfortable. It sticks out forward like this picture. I performed the radiofrequency ablation at the lesion with 7.5 mm tip and 30 watts. After the radiofrequency ablation, the lump decreased a lot, decreasing by 75% after 3 months and by 84% after 1 year. As the lump decreased, a lump that was pressed underneath looked relatively large. He is planning a second radiofrequency ablation. She had undergone a robotic thyroidectomy 12 years ago. Recently, she palpated a small lesion at her anterior neck. The lesion was diagnosed as recurrence at FNA at an outside clinic. Serum thyroglobulin and thyroglobulin antibody tests were negative. It was a very small lesion that was located underneath the skin. She didn't want surgery to leave any scars behind. She therefore desired to use radiofrequency ablation to remove the lesion. Avoiding skin burns is the most important precaution while using radiofrequency ablation on this lesion. Her neck may be scarred as a result of the burns. In previous videos, I explained the postoperative surveillance of a patient who had undergone surgery. You should weigh the advantages and disadvantages of any procedure or treatment before choosing one. The lesion was too small, and the serum test was normal in this patient. So it's hard to determine whether treating this small recurrence will necessarily benefit her. After I explained this to her enough, she chose follow-up instead of immediate treatment. The patient arrived at the hospital 3 months before her scheduled ultrasound follow-up, which was scheduled 6 months later. Because the lesion was touched and disturbed all the time, the patient desired to have it removed. I therefore carried out a radiofrequency ablation. This is the recurrence on ultrasound. It's right under the skin. In order to prevent skin burns and damage to the surrounding structures, hydrodissection with cold fluid was done around the recurrent cancer. This photo shows a hydrodissection in which a needle is performed in front of the lesion. There were no skin burns or any issues following the radiofrequency ablation. 3 weeks following ablation, she could not palpate the lesion. A month after ablation, the lesion turned to a little hypoechoic lesion on ultrasound, and 3 months later, it vanished entirely. She was quite happy with the treatment she received. Serum thyroglobulin was slightly increased in this patient. A small recurrence was found at her lateral neck on ultrasound. After hydrodissection, the lesion was separated from the surrounding structures by cold 5% DW. I'll play a hydrodissection clip for you. This is a recurrence and this is a common carotid artery. A small recurrence is located in front of the common carotid artery. Following hydrodissection, the lesion was surrounded by cold fluid. After placing the radiofrequency ablation tip on the lesion, it looks echogenic like this when burned by radiofrequency ablation. Serum thyroglobulin was slightly increased in this patient. A small recurrence was found at her lateral neck on ultrasound. The recurrence is quite close to the vagus nerve, so you have to move them away by hydrodissection. After the hydrodissection, you can see that there is a considerable gap between them. Thank you.